Hello, everyone. Today I'll be discussing a South Carolina State Board of Nursing violation case involving a registered nurse whom I will refer to as Nurse E. This case provides important lessons about patient abandonment, delegation, and accountability. I will summarize the violation, reflect on whether a similar situation could occur in my own practice, propose strategies to prevent this type of violation, and evaluate the board's final decision. In this case, Nurse E committed several serious violations of nursing practice. She abandoned her patients by leaving her assigned shift early without formally notifying management or ensuring safe coverage. She also gave her medication cart keys to an unlicensed assistant personnel, which is considered unsafe delegation. In addition, she withdrew controlled substances including Sonata, Ativan, hydrocodone, and tramadol, but failed to document them as administered at the time. Finally, she refused to comply with for-cause drug testing and did not complete requirements for the state's recovering professional program. This incident occurred in April of 2017 at a retirement center. The nurse was scheduled for a 7 a.m. to 3 p.m. shift, but left the facility at around 12:30 p.m. after reporting that someone was breaking into her home. Instead of alerting her supervisor, she only texted a coworker to say she was leaving. At that time, she was the only nurse on duty, which left residents vulnerable without licensed supervision. The next day, she refused to provide a complete urine sample for a required drug screen, and shortly afterwards, she resigned. Although she later obtained her own negative test results, her refusal to comply with official procedures raised concerns about her accountability. The South Carolina Board of Nursing determined that her conduct violated several sections of the Nurse Practice Act, including unsafe delegation, improper medication handling, and patient abandonment. As a result, she received a public reprimand, which permanently remains on her record. She was fined $1,500 to be paid within a year. She was also required to complete continuing education courses in ethics and documentation within 6 months. Finally, the board warned that any noncompliance with these sanctions could result in immediate license suspension. Reflecting on this situation, I believe the likelihood of committing such a violation in my own practice is low. I understand that my responsibility as a nurse is to protect patients first, even when faced with personal emergencies. However, I also recognize that in a stressful or understaffed environment, judgment can be clouded, and errors in decision makers may occur. Factors that make this violation unlikely for me include my awareness of the A&A Code of Ethics and the South Carolina Nurse Practice Act, both of which stress accountability and patient advocacy. I am also mindful that delegation to unlicensed personnel must stay within their scope of practice. On the other hand, potential risk factors might include working in a high stress setting without backup support, being fatigued, or not having a clear plan for personal emergencies. Knowing these factors help me to recognize where I need to be especially careful. To prevent this type of violation, nurses should focus on proactive communication, safe delegation, and accurate documentation. If an emergency occurs during a shift, it is essential to notify management and ensure another licensed professional assumes patient care responsibilities before leaving. Medication security should never be entrusted to unlicensed staff. Documentation must be completed in real time to ensure continuity of care and protect the patient record. In addition, nurses should create a personal emergency plan that outlines how they would respond if an urgent situation arises during work hours. Stress management, self care, and peer support also help reduce the likelihood of poor judgment. Adhering to the ANA Code of Ethics is key, particularly Provision 3, which emphasizes patient safety, and Provision 4, which stresses accountability for one's actions. Consistently following the South Carolina Nurse Practice Act also ensures that care remains within legal and professional standards. The board's decision in this case was both fair and firm. The public reprimand protects public trust and ensures transparency in nursing practice. The civil penalty of $1,500 reinforces the seriousness of the violation. Most importantly, the requirement to complete courses in ethics and documentation provides an opportunity for remediation and professional growth. I agree with the board's ruling because it balanced accountability with education. Rather than immediately revoking the nurse's license, the board allowed for rehabilitation while still protecting patient safety. If I were to suggest any addition, it might be a short period of probation with supervised practice, which would further reinforce accountability. However, overall, I believe the outcome was appropriate and just. In conclusion, this case illustrates how quickly personal emergencies can lead to professional violations if proper procedures are not followed. It highlights the importance of ethical decision making, safe delegation, and accurate documentation. As nurses, our first duty is always to safeguard patients, even in times of personal crisis. By reflecting on this case, I am reminded of the importance of accountability, communication, and integrity in nursing practice. Thank you.